Hi, I'm Dr. Anthony Greiss, and I do Mohs surgery here at Dermatology Specialists of Omaha.
I'm Dr. Dave Waz. I'm a Mohs surgeon here at Dermatology Specialists of Omaha.
I focus on skin cancer patients, the high-risk ones, doing their skin checks, taking care of them as a whole, and doing the Mohs surgery with them.
I picked Mohs surgery because it gives me an opportunity to cure something.
Anytime you ever hear the word cancer, it's scary, particularly to the public.
A skin cancer on a person's face can be a devastation.
Most skin cancers are a squamous cell or a basal cell carcinoma. Not all of them are on a high risk or a difficult area, so they generally can be frozen, excised, and creams can be used to remove them. But when they're in the high risk areas, particularly cosmetic and functional of the face and the head and the neck, we use the technique of Mohs surgery here.
Mohs surgery is a very precise way of looking at a piece of tissue that allows us to directly examine all of the edges to make sure that a skin cancer is completely removed.
Mohs surgery is a technique that allows you to take out a skin cancer under microscopic control.
When we take tissue from the patient, we make a schematic map, and then I take that tissue to the pathology laboratory and immediately look at it under the microscope in order to determine if those margins are all clear.
The tissue is laid out in a process that does not allow it to hide. It can run, but it can't hide.
Mohs surgery in the laboratory is a time and labor intensive process that requires specialized technicians, specialized equipment that allows us to make the slides that allow us to look at the edges of a piece of tissue.
This lab is developed to be able to process tissue within an hour's time. It's called frozen section. You use the coolness of the chambers of these cryostats to freeze the tissue so you can actually cut it rather than use an overnight processing device. That's good because you can get your answer within about an hour.
Having a lab on site allows us control over the laboratory preparation, gives us quality control over the slides, and gives us an opportunity to review those almost immediately.
So the patients don't have to wait for their results. And should it be difficult, we can go back and do another layer and get more if we need to.
After a biopsy is taken, you're naturally apprehensive, and that quick turnaround time offers a tremendous advantage in terms of not being scared for so long.
While you're removing the skin cancer, you're actually saving normal tissue. So you get a high cure rate, you reduce the amount of damage or collateral damage you do.
With Mohs surgery, because we look at the edges of that tissue so carefully and thoroughly, we are able to give an extremely high cure rate, up to 99% for the basal cell skin cancers, 95% for squamous cell skin cancers and cancers that have recurred after a previous treatment. No other treatment comes close in terms of cure rate to Mohs surgery.
It's a cancer, and Mohs surgery cures that, and it's great going home at night knowing you cured something.